What are tumor markers for testicular cancer surveillance? Imagine you've just had treatment for testicular cancer, and now the focus is on making sure it doesn't come back. To do this, doctors use specific blood tests called tumor markers. The main markers they look for are alpha-fetoprotein, human chorionic gonadotropin, and lactate dehydrogenase. These markers help detect if the cancer might be returning or if any residual disease is present after initial treatment. After surgery, especially removal of the affected testicle, doctors regularly check these markers during follow-up visits. If levels of alpha-fetoprotein or human chorionic gonadotropin are high or start to rise, it could mean the cancer is coming back. Lactate dehydrogenase is less specific but can give additional clues about tumor activity or size. These tests are usually combined with physical exams and imaging scans like CORT or MRI to get a full picture of the patient's health. Different types of testicular germ cell tumors produce different markers. Non-seminomatous germ cell tumors often produce both alpha-fetoprotein and human chorionic gonadotropin, so these are especially useful in monitoring those cases. Seminomas, on the other hand, rarely produce alpha-fetoprotein, but they might cause elevated human chorionic gonadotropin or lactate dehydrogenase levels. Because of these differences, surveillance strategies are tailored to the specific tumor type. The timing of testing is important. In the first few years after treatment, when the risk of relapse is highest, markers are checked more frequently, sometimes every few months. As time goes on and the risk decreases, testing intervals may lengthen. These blood tests are part of a broader surveillance plan that includes imaging studies and physical exams to catch any signs of recurrence early. When interpreting the results, if alpha-fetoprotein or human chorionic gonadotropin levels go up or don't return to normal after treatment, it could suggest active disease. This doesn't always mean cancer has returned, but it does mean further investigation is needed. Lactate dehydrogenase levels can be influenced by other conditions, so they are used alongside the other markers rather than alone. It's important to remember that not all testicular cancers produce detectable tumor markers, so normal marker levels do not completely rule out the possibility of recurrence. That's why imaging scans and clinical assessments are equally vital parts of surveillance. Each patient's follow-up plan is personalized based on their specific tumor type, stage, and overall health. In summary, alpha-fetoprotein, human chorionic gonadotropin, and lactate dehydrogenase are key blood tests used to monitor testicular cancer after treatment. They help detect early signs of relapse but are always used together with imaging and physical exams. Following these guidelines helps ensure that any recurrence is caught early, allowing for prompt management. Remember, always consult with your healthcare team for personalized advice and to understand what's best for your individual situation.